Good morning, students. So in the last practical, we have started with age estimation report. As I said, we have divided this topic into three or four parts. So the last part, the first part of this age estimation report, we have covered the medico-legal aspects of the determination of age of a person. So as I said, one must know in which circumstances you are supposed to examine a person for determination of age of a person. So, so that part we have covered in the last practical. Now this is the second part where we will be talking about the dental examination, and based on just dental examination, how we can roughly say what might be the age of the person. Overall, when we are giving the opinion of age, it should always be in consideration with the physical examination, sexual characteristic feature, secondary sexual characteristic feature, dental examination and radiological examination. So the second part we'll be talking about, it is the dental examination in the age estimation report. Again, before I start this practical, as we have the first term ending examination in the next month, you might be knowing the timetable, it must be communicated through the dean office. I would like to recommend two books for undergraduate student. The first book, it is by Dr. Rajesh Bardare. The name is Principles of Forensic Medicine and Toxicology. Now, as your curriculum is as per the competency based medical education, this book has also incorporated all the guidelines as per the CBME. So this is the first book. It's a good book where Dr. Rajesh Bardare, he has explained in a very simple concept, in a very simple language, the concept, different concepts of this forensic medicine. Also, different color photographs are also there for your easy understanding. So I would like to recommend this first book. This is a recent edition he has launched, that is the third edition. And the second book, it is the Essentials of Forensic Medicine and Toxicology by Dr. K.S.N. Reddy, that is Narayan Reddy. I would like, it's a very sad news that in this month, Dr. Narayan Reddy, he expired. So this is the second book I would like to recommend by Dr. K.S.N. Reddy, that is Forensic Medicine and Toxicology, the Essentials of Forensic Medicine and Toxicology. Again, a very concise book in a very detailed manner. All the information related with the forensic medicine, it is there in this book. So both the books, they are very good. Just go through these two books. So now we will see the dental examination, how we can come to know what might be the age of the person just by dental examination also. Now, as you are aware, the dental examination, the eruptions of this teeth and calcification of the teeth, it has a specific period. The eruption and calcification, based on that you can say what might be the age of the person. So each and everyone is aware there are two sets of teeth in the first year. You must have studied this. So first, it is called as deciduous teeth. It is also called as temporary teeth. That means milk teeth. दुधाचे दात म्हणतो आपण बऱ्याचदा. And the second is permanent teeth. So deciduous teeth and temporary teeth, they are replaced by permanent teeth, and few more teeth, they are added in the jaw. So temporary teeth, they are 20 in number. Permanent teeth, they are 32 in number. So which are these temporary teeth? So in each jaw, the central incisors, there are two, canine 1, molar 2. So I am talking about on one side. So two central incisors are there, one canine is there, and two molars are there. That means it's a double in each jaw. Then permanent teeth, they are 32 in number. So central incisors again 2, canine 1. The temporary molars which are there, they are replaced by premolars, and 3 molars, they are more added in each jaw on each side. So they are 32 in number. So 16 on the mandibular side and 16 on the upper side, maxillary side. So when you are examining a person, especially a child, where there is a mixed dentition, where temporary teeth and permanent teeth, they are present in a single individual, in a single child, one should be in a position to differentiate which one is temporary teeth and which one is permanent teeth. So how to differentiate this? So if you look at the temporary teeth, they are usually smaller, they are lighter, they are narrow, except temporary molars. As I said, these temporary molars, they are replaced by permanent premolars. So here the comparison, it should be of temporary molars with that of permanent molars. So rest of the temporary teeth, they are usually small, they are lighter and they are narrow, except temporary molars, which are longer. So temporary molars, they are longer than the permanent counterpart, that is permanent premolars. While permanent teeth, they are heavier, they are stronger, they are broader as compared to the temporary teeth, except the one which are replaced by temporary molars by permanent premolars. If you look at the anterior teeth, how they are placed, the anterior teeth, they are placed vertically, while the anterior teeth in a permanent teeth, the anterior teeth, they are inclined a little bit anteriorly or forward, you can say. The color of temporary teeth, they are china white in color, while the color of permanent teeth, it is somewhat ivory white or dusky white in color. The shubhra pandra je म्हणतो, that is of temporary teeth, and ivory white or dusky white, it is of permanent. If you look at the neck, as you are aware, there are three parts of each tooth. The one part which is been visible, that is a crown, and the part which is invisible, that is a root, and in between root and the crown there is a small part which is called as neck. So neck is more constricted in temporary teeth, while the neck in permanent, it is less constricted as compared to the temporary teeth. If you look at the roots of temporary teeth, they are narrow, they are longer, while the roots of molar are smaller and more divergent. Permanent teeth, the roots, they are usually broad, they are short, while the roots of molar are larger and less divergent. Now there is a ridge or a thick edge which is present at the junction of crown with the fangs, that is the upper part. While such type of ridge, they are usually absent in a case of permanent teeth. So this is how you can differentiate the temporary teeth and permanent teeth. Moreover, many times it may not be possible when there is a mixed dentition. It is difficult to say whether that is a temporary or permanent teeth. The best thing, you can go for the X-ray examination. If a temporary teeth is there, there might be just below that there is a bud or root of permanent tooth which might be there just below that. So that things can be visualized on X-ray examination. Thereby you can say this is a temporary teeth and this is a permanent teeth. There are certain X-rays I will show you later on, by which it will be easy for you how to differentiate temporary teeth and permanent teeth based on X-ray examination. Now developmentally, when we are talking about permanent teeth, there are two sets of teeth. One is superadded teeth and second is successional teeth. So what is the meaning of superadded and successional teeth? One should know. So superadded teeth means, as the name indicates, they are added or superadded. So teeth which do not have deciduous predecessors. As I said, temporary teeth, they are replaced by permanent teeth. But there are certain teeth which do not have deciduous predecessors. All these teeth, they are categorized as superadded. So they are not replaced. So these teeth, they don't have any predecessors of deciduous, but they are newly formed permanent teeth. So usually they erupt behind the temporary teeth. So temporary teeth, when 20 teeth are there, just behind that few teeth they erupt, and these are called as the superadded teeth. So they usually erupt behind the temporary teeth. So which are these teeth in permanent? So these are the all permanent molars, they are super added teeth. So as you are aware, 20 they are temporary and 32 they are permanent. So 12 teeth they are super added. Which are these 12 teeth? They are 3 on each side in the lower jaw. That is 6 permanent molars on lower side and 6 permanent molar on the upper side. They are all super added permanent teeth. Then successional teeth. Again the name itself indicates successional teeth means they are replaced. So teeth which erupt in place of deciduous teeth. So whatever the deciduous teeth are there, temporary teeth are there, mill teeth are there, they are replaced by permanent teeth. All these teeth they are called as successional teeth. So 20 teeth they are usually successional. So permanent molar, premolars, they erupt in place of deciduous molar. This is important. Now as I said, 2 canines are there on each side. So 2 canines they are replaced by permanent canines. Incisors, 2 incisors are there. They are replaced by 2 incisors. 1 canine is there. Again that is replaced by permanent canine. Now most important thing that one should remember, and there is always confusion in the undergraduate students, it is about the permanent molars, temporary molars or mill teeth. So temporary molars they are replaced by permanent premolars and not by the molars, right? So always remember, permanent premolars they erupt in place of deciduous molars, and all these teeth they are successional teeth. Now as I said, this is an anatomical part. Now what is important, how to say what might be the age of the person based on dental examination. It is the way how the teeth they erupt. There is a sequence by which it erupts, and there is a particular age by which they erupt, and based on eruption of the teeth, at what time they erupt, based on that you will get some rough idea regarding the age of the person. So one must know the sequence of eruptions. Many times there is a confusion among undergraduate students how to remember all these teeth, at what age it appears. There is an easy formula I will tell you later on. Just try to understand first sequence, and then it is easy to understand at what age it appears. So first we are talking about the temporary teeth, and then we will see the permanent teeth. So temporary teeth they are 20 in number, which are these: central incisors, 2 canine and 2 temporary molars. So the first one to appear, it is the lower central incisors. So as I said, one must remember, the sequence first. Which teeth appear first and what is the sequence later on. Then it is easy to understand the age, particular age at which it appears. So central incisors to appear first. Lower central incisors, it appears first. It appears at the age of 6 to 8 months. Then appears the upper central incisors. The upper central incisors, it appears at 7 to 9 months. Then appears the upper lateral incisors. So now we are talking about the lateral incisors. It is the upper lateral incisors which appears first. It appears again at the age of 7 to 9 months. Then appears the lower lateral incisors. It appears at 10 to 12 months. So after birth till 1 years of age, how many teeth will be there? There will be appearance of central incisors. So all the incisors will appear till 1 years of age. It is easy to remember, as I said, central incisors 6 to 7, 7 to 8, 8 to 9 and 10 to 12. So how to remember? 6 to 7, 7 to 8, 8 to 9, then 10 to 12. This is how one can remember in month. So temporary teeth, it is in month. Then appears the first molar. It appears around 12 to 14 months. So around 1 year, there appears the first molar. So it's not the canine which appears after the incisors, but it is the first molar which appears later on. Then appears the canine, and it appears around 1.5 month, that is 17 to 18 month. Then appears the second molar. It appears around 2 to 2.5 years, right? So this is how one can remember very easily. First remember the sequence, that is lower central incisors, upper central incisors, upper lateral incisors, lower lateral incisors, first molar, canine and second molar. So this is the sequence. If you remember the sequence, then you can remember in month, central incisors 6 to 7, 7 to 8, 8 to 9, or 9 to 10, you can say, or 10 to 12. Around 1 year, the first molar will appear, 1.5 year, canine will appear, 2 to 2.5 years, the second molar will appear, right? So by 2.5 years, almost, you will get all 20 temporary teeth in a child, right? So is that easy? I hope it is easy for you if you remember the sequence, right? So after that, after temporary teeth, usually all these temporary teeth, it will remain for some years, and slowly again sequence wise these temporary teeth, they are replaced by permanent teeth, and few more added super added teeth will also appear in the jaw. Again, based on that, it is easy to say what might be the age of a child. So again, the sequence is important even in the permanent teeth. And the first permanent tooth to appear, it is the first molar. So first molar, usually, as I said, the first molar it appears, it is the first permanent tooth to appear. It is a super added teeth, it is not a successional teeth, it is not replaced by temporary teeth. So already in a child who is having 20 teeth, the first molar it appears behind the temporary second molar, and therefore when the first molar appears, usually you will get 20 plus 21, 22, 23 or 24 teeth in that child. So the first molar usually it appears at 6 to 7 years of age. So if you say, if you check a child, if you are examining a child whose age is roughly 6 to 7 years, he will have 20 temporary teeth and 4 first molar teeth. Right? So total 24 teeth might be there at the age of 6 or roughly around 7 years of age. Is that clear? So again, sequence is important, as I said. So the first to appear, it is the first permanent molar. It is a super added teeth. Then appears the central incisors. Here it is not upper and lower and upper, but it is the central incisors. Usually it appears in the lower jaw first, and then it appears in the upper jaw. But to remember the sequence wise, just you can say next to appear, it is the central incisors. It appears around 6 to 8 years of age. So 6 to 7, 7 to 8. First molar 6 to 7, central incisor 7 to 8. Usually in the books it has been mentioned in the range of 2 years, but to easy remembering, you can say 6 to 7 and 7 to 8. Then appears the lateral incisors. It appears at 7 to 9, that means 8 to 9. So sequence wise, 6 to 7, 7 to 8, 8 to 9. That is the lateral incisors. Now after lateral incisors, again I am saying it is not the canine to appears, but there is a first premolar. So the temporary first molar, it has been replaced by first permanent premolar, roughly around the age of 9 to 11 years of age. Then the second premolar, again it is a successional teeth. The temporary second molar, it is replaced by second premolar, permanent premolar. So in temporary there are no premolars, but in permanent there are premolars. So second premolars, it appears around 10 to 12 years of age. Now what is the sequence? From first molar to second premolar, it is 6 to 7, 7 to 8, 8 to 9, 9 to 10, 10 to 12, right? So a range of 1 year, if you can remember, 6 to 7, 7 to 8, 8 to 9, 9 to 10, 10 to 11 or 12 years. This is how one can remember till second premolar. Next in the sequence, it is the canine, which get replaced at 11 to 12 years of age, right? So the last temporary tooth to be replaced by permanent, it is the canine. Henceforth, there are no temporary teeth. All teeth will be of a permanent. So after 12 years, you may not get any temporary or deciduous teeth. So the period of mixed dentition, it is from 6 years up to the 12 years of age. That is all the temporary canines. Once they are replaced by permanent, there will not be any temporary teeth. So all the successional teeth now up to this 12 years of age, that child will have 24 number of teeth, right? So all 20 temporary teeth and 4, that is the first premolar, right? So this is how the numbering will be there in a child. Then appears the second molar. Usually it appears by 12 to 14 years of age. So again, that is a super added teeth. And the last to appear, it is the third molar. It is very difficult to rely on this third molar. Many times the third molar, as you might be knowing, it is also called as wisdom tooth. मराठीमध्ये त्याला अक्कल दाढ म्हणतो आपण, अक्कल दाढ. So अक्कल दाढ, it may not appear at all because there might not be any अक्कल, and therefore there may not be any third molar. Evolution wise, many times the third molar may not appear. Once the second molar appears, the jaw might get extended posteriorly and it creates a space for appearance of third molar. But if there is no proper space for eruption, it may not erupt at all, and therefore it is difficult to rely on this third molar. But if it is present, the eruption of the third molar, it appears by the age of 17 to 25 years of age. So how to remember sequence wise, as I said, so the first molar 6 to 7, central incisors 7 to 8, lateral incisors 8 to 9, first premolar 9 to 10, second premolar 10 to 11, canine 11 to 12. So sequence wise you can remember. Then appears the first second molar, it appears by 12 to 14, and third molar, it appears by 17 to 25. So this is how one can remember. Otherwise there is a jumbling many times, as I said. Again I am repeating, one should remember the sequence in temporary teeth as well as in permanent teeth. In temporary teeth, it is the central incisors which appears the first, and then you can start the sequence. But here in permanent, it is the first molar, it appears first, and then the sequence is there. Then what is the period of mixed dentition? Now when you say period of mixed dentition, the name itself indicates mixed dentition means in a single individual, in a single child, both temporary and permanent teeth, they are present at a moment, and that is called as period of mixed dentition. So from what to what age it is called as period of mixed dentition? As I said, when the first permanent molar appears, that means from 6 years of age. So first molar it appears, that is a permanent molar, it appears at 6 years, 6 to 7 years. Along with that you will get temporary teeth, all the 20 temporary teeth. And the last tooth to be replaced by permanent is the canine. Once the canine get replaced, there will not be any temporary teeth. So period from 6 years to 12 years, that is called as period of mixed dentition. About 6 to 7 years, if you say what is the age of the child, roughly around 6 to 7 years, that child will have 24 teeth in an individual. So which are these? These are 4 permanent molars and 20 temporary teeth. Along with these 4 permanent molars, you might get central incisors which might be again permanent. So 4 plus 4 might be there, or 4 plus 20 temporary teeth might be there. If you check the age of the person, if you are examining a person or a child of 9 years of age, again you will get 24 teeth. But the numbering of temporary and permanent teeth will vary. So at the age of 9 years, that child will have 12 permanent teeth. So these are 8 incisors. All the incisors will be replaced, temporary incisors will be replaced by permanent incisors, and 4 molars, as they are the first to appear, these are present. Also there are 12 temporary teeth, and these are 8 temporary molars will be there, and 4 incisors. not four incisors, these are, sorry, canine, and four canines are there. So this is a mistake, there is a mistake. So these are four temporary canines which are there, which are yet to be replaced. Then from age 11 to 24, you will have again 24 teeth. Which are these? 20 permanent teeth are there, 8 incisors. The temporary molars, these 8 temporary molars, they are replaced by 8 premolars, and the 4 molars usually they are present from the starting. Along with that, you will get 4 temporary teeth, there are 4 canines. So this by mistake incisors they are written, but these are rather canines. 4 canines are there. At the age of 14 years, so after 12 years, there will not be any temporary teeth. At the age of 14 years, you will get 24 permanent teeth and 4 more teeth, that is second molars, they get erupted. So by 14 years, you will have second permanent molars which are added in the 24 teeth, and after that 24 teeth might change to the 32 as and when the third molars get erupted. So this is how the changes in the individual, in a child, you will observe based on temporary teeth, based on temporary and permanent teeth, and depending on that it is easy to say what might be the age of person. So many times it has been recommended that you can go for OPG view for clear visualization of this teeth. OPG view, that means orthopentographic view, orthopentograph view. So it is a panoramic view where all the teeth they are visualized in a single plane. So this is how it looks like in a panoramic view. So what you can view here, these are the temporary teeth and these are the buds, they are yet to be erupted. These are the roots of permanent teeth. So what is there, if you can check on one side, this is a temporary, this is a incisor, these are all not, these all are not sorry, these are not temporary teeth. Few might be permanent and few might be temporary. So you need to check just below that whether there is any root which is been erupted, root of permanent molars, permanent teeth tooth they are erupting. So if you can check on one side, 1, 2, 3, 4, 5, 6. So 6 teeth are there. How many temporary teeth are there? They are temporary. And this is the first tooth to appear. That is a permanent tooth. That is the first permanent molar is there. So these are 1, 2, 3, 4, 5. The sequence wise central incisors, lateral incisors, canine. These are 2 temporary molars. And this is the first permanent molar. As just below that you cannot observe, there is no shadow of root, and therefore you can conclusively say, as I said, how to differentiate temporary and permanent teeth. Just below that, can you see such type of shadow here? No. That means this is a permanent tooth. There is no root which has been erupting below that, and these are temporary teeth. This is also the root which has been showing, and here again there is no shadow. That means the central incisors they are permanent. Lateral incisors, it is in the phase of replacement. This is a canine, again permanent root is there. Just below that, temporary molars, again the root for permanent premolars which are there. So what might be the age of the person? So these are, if you can check physically, there are 24 teeth. Out of that, this is a permanent first molar. These central incisors, they are permanent. So what might be the age? Central incisors, permanent central incisors, it appears at the age of 7 to 8. So roughly the age of the person here is around 7 to 8 years of age. Then this I am talking based only on dental examination. So this is the second view. You can count the teeth. Now what is this in the last shadow again? What is this? This is the shadow of permanent second molar. This is yet to appear again. The same shadow you will observe here. So this is a shadow of second molar again. This is not erupted into the cavity. Now how many teeth are there? These are central incisors, lateral incisors, canine, then first temporary molar, temporary second molar, and this is the first permanent molar. So the roots for temporary premolars are there and canine is yet to be replaced. But central incisors and lateral incisors, they are replaced. There are no underlying roots which are present. So here the age is roughly around 8 to 9 years of age, or you can say 9 to 10 years of age. So around 1 year there is a difference. So this almost replacing thus a temporary first molar. Now when all the temporary teeth they are replaced by permanent, how it will looks like? So we can start from the center, this central incisor, lateral incisor, canine, then first premolar, second premolar, first molar, second molar, and third molar. It is impacted, it is yet to erupt. So the root of third molar, it can be visualized as impacted, it is yet to appear into the oral cavity, right? So you can check the root, there are no underlying shadows, so that means all the teeth they are permanent. I will repeat again: central incisors, lateral incisors, canine, first premolar, second premolar, first molar, second molar. So roughly when the second molar appears and third molar is yet to appear, you need to check whether there is a space behind the second molar. There is a lot of importance which is attached with this space behind the second molar. When you can visualize on naked eye examination, as I said, after appearance of this second molar, usually the jaw grows posteriorly to accommodate the space for the eruption of the third molar. So if spacing is there but third molar is yet to appear, that means the age of the person, it is above 14 years of age. Many times because of the evolution, the third molar may not appear, and such type of picture if it is seen, that means it is called as impacted third molar. It is yet to appear. But if there is a calcification of this root of third molar, you can say the age of the person is above 25 years of age if calcification is there. If calcification is not there and a small part of the third molar it is visualized in the oral cavity, you can say the age of the person it is in the erupting phase and the person has crossed 17 years of age. So this is how, based on that, you can say what might be the age of the person. There is a lot of variation. There are number of factors which affect this eruption and calcification. More or rather than calcification, it is the eruption which is more important. And based on that, you can easily say what might be the age of the person about 25 years of age. After 25, it is difficult to comment based on dental examination. Few points one should remember while giving opinion based on dental examination. Usually the dentition it erupts earlier in the lower jaw, except the upper lateral temporary incisor. Then wisdom tooth usually it appears in the lower and left side, and then it appears on the right side and upper side. The number and eruptions of the deciduous teeth is more regular as compared to the permanent teeth. So up to the age of 2.5 years it is easy, but rarely you will get, rarely as a in medical legal point of view, rarely you need to examine a child up to 2.5 years of age. But if you compare temporary and permanent teeth, the number and eruptions of the deciduous teeth, it is a very unique pattern as compared to the permanent teeth. Teeth eruption in the female may be 1 year before that of male. So when you are examining a girl, usually you should be on the lower side, as we have seen in the examination, at from what to what age that tooth appears, you should always consider in a female tooth eruptions it is roughly 1 year before as compared to that of male. Dental and skeletal age, usually it corresponds closely in male or in boys as compared to the female, where in case of female the skeleton age is 1 year ahead of the dental age. There are different factors that one should consider. You should also note down the background of that person before you comment about the age from the dental examination, because it might affect the eruptions of the teeth. The factors like hereditary, environment, from which background, from which environment the person has come, endocrinal reactions, certain endocrinal reactions, again it might affect the eruptions of the teeth. The nutrition of a child, whether the person belongs to low socioeconomic strata or the person belongs to rich family. So how is the nutrition of the person, how is the calcium intake of the person, based on that eruptions will affect whether the person is suffering from any disease, especially sexually transmitted disease like syphilis. In that the teeth might erupt early. So these are the few diseases, hereditary factors and other factors one should consider before you give opinion on the age of the person. Now what is the procedure that is to be followed while examination of the person? The eruptions of the teeth on physical examination can be graded as follows. Now when we are talking about procedure means when you are examining on naked eye examination, you need to have certain views, certain scores or grades. What is the meaning of eruptions and what is the permanent complete eruptions, that one should understand here. So stage 1, it is a non-eruptions of the temporary tooth, or when you are talking about a permanent tooth, there is a fallout of the temporary tooth and non-eruptions of the corresponding permanent tooth. So stage 0 means like for molars at the age of 1 year there is no molar, that means there is no eruptions, while in case of temporary teeth has fallen but new teeth in that place, it is yet to appear, that stage is 0, that is non-eruption. Then second, stage 1, when the tip of the crown, it has just penetrated into the gum margin, that is a stage 1, that means in an erupting stage. Stage 2, when the crown has grown into the oral cavity beyond the gum margin, but it is yet to reach the occlusal surface. Occlusal surface म्हणजे चावण्याची जी जागा आहे तिथपर्यंत it has not reached. It has just penetrated into the oral cavity. And in the stage 3, when the occlusal surface came in contact with the counterpart and the bite was complete, म्हणजे सगळे टीथ वरून सगळे सारखे लेवलला आलेले आहेत, then that is a complete eruption of the teeth. So non eruption, erupting, partly erupting and complete eruption, these are the stage 0, stage 1, 2 and 3, and based on that it will help in the proper estimation of the age of the person from dental examination. Now once you have noted down the teeth, one should know how to chart, how to put it on the report. Now there are different methods by which the dental charting is being studied. So first chart, it is by universal system. In the universal system, this is how one can chart the teeth from the upper teeth. They can be charted from right side to left side. That is a permanent teeth 1, 2, 3, 4, 5, 6, 7, 8. These are central incisors, lateral incisors, canine, first premolar, second premolar, first molar, second molar, and third molar. So up to 16 number that is being charted, 1 to 16, and from left lower side 17 to 32. This is the method which is being used in a universal system. This is not in use oftenly. The second system, it is a palmar notation. In palmar notation, it is like the quarters. There it is, the jaw is divided into 4 quarters: right upper, right lower, left upper, left lower, and each quadrant it is divided into 1 to 8, 1 to 8. For temporary it is 1 to 5 and 1 to 5 for temporary. This is how the palmar's notation is there. Then third is head rough system. In head rough system, it is just like that of a palmar notation from 1 to 8. The only thing from the uh, upper teeth, they are designated as plus 1 plus 2 like that, and the lower tooth they are designated as minus 1 minus 2 minus 3 till 8, or in temporary 1 to 5. So plus it is designated for the upper teeth and negative for the lower teeth. The most commonly used method for dental charting in medical legal examination, it is FDI method or modified FDI method. One should be thoroughly aware about this FDI method. So this is the charting in FDI method which is being used. You should always write which one is right side, which one is left side. Each quarter it is divided into 4. A quadrant is divided into 4, and all the teeth in the sequence wise they are being charted as 1, 2, 3, 4, 5, 6, 7, 8 like that of Palmar's notation. The only difference here, you will observe two numbers. This number which is there in the red mark, it explains the quarter, which quarter is there. So 1, it is designated here as right upper quadrant. Then 2, it is designated as left upper quadrant. 3, it is designated as left lower quadrant, and 4, it is designated as right lower quadrant. So the teeth they are designated numbered at 11, 12, 13, 14, 15 in the right side. Likewise 21 to 28 on the left upper side, 31 to 38 on left lower side, and 41 to 48 on right lower side. Now this is for permanent teeth. What about the temporary teeth? In temporary, this one number it is replaced by 5. 5, 6, 7, 8. So 51 to 55, that is right upper quadrant. 61 to 65, left upper quadrant. 71 to 75, that is left lower quadrant, and 81 to 85, that is the right lower quadrant for temporary teeth. So numbering for the quarter is different in FDI method. 1, 2, 3, 4, that is for the quadrant, and 5, 6, 7, 8, that is for the temporary. Now this is a recent method, that is modified FDI. There is a slight change in the numbering of quadrant. So right upper quadrant it is 1, left upper quadrant it is 2, same like that of FDI. The only they have changed, it is 1, 2, the 3 it is for the right lower quadrant, and 4 it is for the left lower quadrant. Likewise for temporary it is 5, 6, 7 and 8. So 5, 6 it is same, but 7 it is for the right lower quadrant, and 8 it is for left lower quadrant for temporary teeth. So that is the only difference. So when you are writing the charting in your medical legal report, one should use FDI method or modified FDI, and whatever method you are using, you should always write which method you have used, whether the dental charting is by FDI method or whether it is by modified FDI method. Now as I said, determination of age of a person, it is by up to 25 years of age. Roughly you can very well say the age of the person based on dental examination. It is difficult to comment the age of the person after 25 years of age. So how to comment after 25? It is by Gustafson's method, but for that you cannot do it in a living person. You can do it in the dead person, where you need to extract the tooth and you need to do some procedure on the tooth to check the few parameters which are used in Gustafson's method. I will not go into detail, just go through the books in the detail about this method. There are certain parameters you need to check in the tooth, particular tooth. So first is the attrition, and this is the wear and tear in a particular individual or in particular tooth. Based on that, the age of the person is calculated. So there are total 6 parameters that you need to check in the Gustafson's method. The first is attrition, second is periodontosis, third is secondary dentin formation, fourth is cementum apposition, fifth is root resorption, and sixth is transparency of the root. So by this these six parameters they are used in the Gustafson's method for determination of age after 25 years of age. So this is not up to 25, this is not in a living, that one should remember in the Gustafson's method. The other methods, that is Boyd's method. In Boyd's method, the cross striations develop in the enamel of the teeth till complete formation of enamel is there. Enamel means it is the outer covering on the teeth, and usually there are certain cross striations which develop in the enamel, and based on that this method is used in the Boyd's method. They represent the daily incremental lines. So whatever the lines which appears on the enamel, these are calculated for the Boyd's method. So the age of the individual is calculated in terms of days by counting the number of lines from the neonatal lines onward. It is useful to estimate the age of a dead infant. So just you need to count the lines from the neonatal line onwards till the complete formation of the enamel. Then the second method, it is a stacks method. This is a method to know the age of an infant from the weight and height of erupting teeth of a child. So these are the three methods: Boyd's method, Stack's method and Gustafson's method. These are used especially in case of a dead persons for determination of age from dental examination. Now I will give you one small exercise, that is you can draw a dental charting of a 9-year-old girl as per modified FDI method. Not only charting is important, you need to give reasoning, proper reasoning, why that particular teeth, whether it is temporary or permanent, whether it has appeared and what is the age at which it appears. So that reasoning you need to mention below the charting. Only charting is not important. Along with that, you need to explain what is that tooth and what is the reason. Then second exercise, draw a dental charting of a 13-year-old boy as per modified FDI method, and also below that you need to explain with reasoning, proper reasoning. You need to, once you finish your exercise, then send a scanned copy of your report via mail. The mail ID will be communicated to you by the resident. Our resident doctor will inform you the mail ID. So this is the exercise for you. This is all about the second part of the dental exam. This is the second part of age estimation. If you have any doubt, just let me know. So thank you very much.